In today's health headlines, low-income Americans are getting way too much salt. A new explanation for long COVID and new information on a flame-retardant chemical found in the blood. Joining us is Dr. F. Perry Wilson, Associate Professor at Yale School of Medicine. Welcome to you.
Thanks for having me.
You bet. Sodium intake is associated with an increased risk of mortality, and 80% of low-income Americans are getting way too much of it. How can we change this?
This is really hard. We all know that salt, and especially excessive salt, is not very good for us because of relationship to high blood pressure, stroke, and heart attack. But we have new data out now from 65,000 people, predominantly in the southern part of the U.S., that found that fully 80% of them exceeded the recommended daily intake of sodium, which is 2,300 milligrams. The average sodium intake was around 4,500 milligrams, so, nearly double. And people who exceeded that risk, that minimum level, had about a 30% increased risk of heart attack and stroke. The researchers estimate that fully 10% of heart attacks in this country can be linked to high sodium intake, so it is a problem. The solution is avoiding those prepackaged and processed foods. That's where you get the sodium. I tell my patients, stick to the outside of the supermarket, where your fresh fruit, fresh vegetables, fresh meats are. Try to stay away from those inner aisles. That's where you see a ton of sodium.
And there are a lot of inner aisles.
Sure are.
All right, antibodies that mimic enzymes could be a new explanation for long COVID. What do we know about that?
Yeah, this is COVID once again, pushing the frontiers of our understanding. These are chemicals called enzymes, which up until now was really kind of fringe and even potentially unimportant observations found in some lab animals, which are antibodies that act as enzymes, meaning they can break down other proteins. We've never seen these in human diseases before, but now a new lab is reporting in some early studies that some COVID antibodies can act this way. And it might be an explanation for why people, even long after the COVID is out of their system, the antibodies are causing strange reactions like some of these long COVID syndromes. So this is going to need to be confirmed in larger studies for sure. But it is really good to see people investigating long COVID, which continues to baffle a lot of scientists.
Yeah, boy, no kidding. And finally, a new study found a flame retardant chemical in the blood of about 1,000 participants, and it's linked to a 4-fold increased risk of cancer. This sounds alarming.
It is a bit. You're going to make me say this. This chemical is called polybrominated diphenyl ether, or PBDE, and it was used as a flame retardant in a variety of products until it was banned in the U.S. in 2013, and so that's all good. But the thing is, it's still out there. It's in the soil. It is in our food chain, and people are predominantly getting it now from eating high-fat fish, meat, dairy, and maybe even some fish oil supplements. This was a study, as you mentioned, of 1,000 people that found that in the group that had the highest levels, the highest third of the population, they had 4 times the risk of cancer than the lowest third of the population studied. That is concerning, and it's something that probably will need to start getting measured in various places in our food supply to make sure that we're not getting exposed to this already banned chemical through the food that we eat.
All right. Dr. Wilson, thanks so much for being with us today. Have a good one.
You too.